without any further ado, bring up someone who is really a star in the House of Representatives. While I was on, like I said, I was on vacation, but I saw her yesterday on CNN on the panel. She did an excellent job. And despite the acrimony that's going on there, I mean, she is steadying a wave of arguments that is bringing us confidence in Prince George's County. And she is here to talk about the Affordable Care Act. And I don't know about you, I'm tired of Obamacare. We should call it, you know, I think it's demeaning to call it Obamacare. This is a major policy initiative that certainly deserves our attention, and it's called the Affordable Care Act. And let's stop demeaning our president. Sorry for the commercial, but let's stop demeaning our president by saying that it's Obamacare. We don't call building streets and transportation Harrington Care. We call that transportation, right? So let's call it the Affordable Care Act. But without any further ado, I'd like to bring up my friend, a true scholar, if you will, and a great politician, Congresswoman Donna Edwards.
Well, thank you, David, very much for stalling. I appreciate that. Good morning, everyone. How are you all doing this morning? Good. Well, this is about the best voice I think I've had, actually, in about 2 weeks. And I would like to say that it was some of those fellows over there driving me crazy and making me lose my voice, but that's probably not true, so I won't exaggerate. What I will share with you this morning, a couple of things, just as we, get started. You all know that we are now at the, into the second week of this government shutdown. And although the Department of Defense has ordered about 400,000 workers back to work, they are back to work, and even though we've said that they eventually are going to get retroactive pay, they're not being paid now. And another 400,000 or so are still at home. And a lot of those people are here in our congressional district. They're here in our county. Prince George's County has about 145,000 federal workers and retirees. And that's pretty significant for our local economy. People who get up and get a cup of coffee, or they go to the dry cleaners, or all the other things that folks do in addition to going to work and spending their money here in Prince George's County. And so the government shutdown has a really tremendous impact on all of us. And yesterday when I was on CNN, I was with a gentleman who represents a district in Iowa, and his name is Steve King, and he seems to think that shutting down the government, one, is not a big deal, that somehow it sends some message to, I don't even know who the message is going to. But the fact is that over the weekend, the President of the United States, as Commander-in-Chief, conducted two really aggressive, intentional operations with our Navy SEALs, and our government is shut down. I mean, this is an embarrassment for us in the world. It isn't just about what we're doing domestically. And so I hope as we go into this next week, although it didn't seem quite hopeful over the weekend listening to Speaker Boehner on this week, that we would get to a point of negotiation. But I do hope that we do. And I will say this about negotiation. The budget number that virtually every, I think all but 5 House Democrats have supported at $986 billion to continue funding the federal government until November 15th in this short-term continuing resolution, is a number that is actually below the budget proposed by Paul Ryan that all of us voted against. And people like me who voted against that for a lot of reasons, because it wouldn't really meet our priorities, are willing to take that number, their number, to continue government operations. And so to the extent that anyone talks about negotiation, there's been a lot of negotiation. In fact, that is, a couple of $100 billion below what the president proposed in his budget. The Senate passed the president's budget. The House passed a budget. The appropriate way to deal with our budget is to do it in the regular order of the Congress, appoint conferees from the House and the Senate, and negotiate a budget. It is not to say that we passed a policy that people don't agree with, and therefore we're going to shut down all of government because people don't agree with the Affordable Care Act. I mean, that is just outrageous. I mean, I bet every American could make a laundry list of laws that we don't agree with, but we don't shut down the government because of it. Not the least of which might be, the IRS. I mean, we don't like paying taxes, all of us, all the time, but we don't shut down the government because we don't like a law. And yet that is exactly what is happening here. And so I think when the president says that he won't negotiate over that, it is not a matter of not negotiating over larger budget questions in the context of a budget negotiation, but simply to continue to put proposals forward that defund the Affordable Care Act, that devalue the Affordable Care Act, that disintegrates the Affordable Care Act. I got a lot of D words in me. Most of them are longer than 4 letters. But to do that and to hold back government is really just outrageous. I had a call from a young woman in my office a couple of days. We've been just getting tons of calls, but from a young woman in my office the other day, and she was sobbing. I mean, just sobbing. And the reason is because at the end of the month, at the beginning of the month, she pays her child care for the month. A lot of people do that. And so she paid out all of her child care for the month, but then on October 1st, she's out of work and she's not being paid. And so she's basically spent, and she has to pay it because if she doesn't, she loses the spot in daycare. And so she is in a real bind. And the fact that we have so graciously said to federal workers with certainty that we're going to make sure you're paid whenever it is that we get started again doesn't help the cash flow issue for that young mom, who's a GS5 worker, by the way. So she doesn't really make a lot of money, and she's a single parent. And so I don't want us to sugarcoat what it is that we're doing for the American people and for our federal workers. I'm glad that we did it, but that doesn't work in the absence of just getting government started again, getting services back to the American people, and having people now we're paying people not to work. I mean, it's such an irony for a group of folks who are so concerned about deficit reduction. We're actually paying people not to work. And and on top of all of that, every week that the government is shut down costs us $10 billion a week, every week. And so already chalk up another $10 billion that we're going to have to borrow to pay because the government is shut down. And so, there are a lot of implications here. And then I will say lastly, before I get into the Affordable Care Act, because it's related, that we are approaching October 17th. Treasury Secretary Jack Lew has already said 3 times, I've read 3 separate letters starting in May of this year, May, August, and just as recently as September 25th, to Speaker Boehner and all of our House and Senate leadership. It says on October 17th, we're going to be running the government on a cash flow basis. And I don't have to tell those of you in the business community that that is completely unacceptable. We have roughly every day about $30 to $50 billion coming in, and there are days when we should have $80 billion going out. Now, any 7th grade math student can tell you that that means that you get an NSF for that, right? And that is what we're facing October 17th. Now, will it be exactly on October 17th? We don't know. Could be the 16th, could be the 20th. But at some point or other, we only have the cash that we take in to pay our bills. And, the United States has incurred those bills, and we ought to pay them. If you had bills that needed to be paid, and you didn't pay them, bad stuff would happen. And that is what's going to happen to the United States of America. In 2011, when we were on the brink of default, the stock market dropped 17 percentage points. We lost about 0.2% in our growth. And that is what, and now we're talking about, there are some people who are actually, my colleague, Stephen King, actually said default doesn't matter, that it's not a big deal, just like shutdown is a slowdown. I mean, this is really, really irresponsible thinking. I was with a group of actually the day that poor young woman was killed on the grounds of the Capitol, we were locked in. Any bankers in the room? Any bankers? I was locked in my office with a group of bankers. It was great. It was great. We talked about a lot of stuff. But one of the things that we did was the Maryland bankers, it was a lot of our community banks, and it was a great meeting. But one of the things that we talked about was the fact that they are just starting to make new business loans and have more credit available for our small businesses. The mortgage bankers are just starting to see an uptick in new mortgages that they're writing. All of those things that we know are good economic indicators for our region, but also for the country. And October 17th, if we hit default, all of that just crashes. And I mean, I don't want, a lot of people have been accused of exaggerating stuff, but it's really not an exaggeration. Right now during the shutdown, just to show you the difference between shutting down the government and a default, that in the shutdown, people still get their Social Security checks and they still get their VA disability checks. There are a lot of other functions of government that aren't working. But in a default, those checks can't be written because of the NSF. And so that is the difference. And so for an awful lot of people, and for folks who have money in your 401ks, your retirement plans, your investments, count on the market just taking a tank. And I think up until now, what you see in a lot of the market reaction is that they're saying, well, they worked it out in 2011, they're going to work it out now. Not really sure how long that continues. In any case, none of you would ever run your business this irresponsibly, and we shouldn't run the federal government irresponsibly. We should not be bringing the federal government back in little tiny snippets. I mean, we funded there were bills to fund like 8 government agencies over this last week, and then some of us were accused of not supporting veterans because we didn't vote for the Veterans Administration to come back online. I mean, my dad was a veteran. He served nearly 30 years. The idea that somehow I was voting against veterans is really absurd. What I was voting against is restarting the government in piecemeal. We have 486 agencies. Why did we pick those 8? And so, so we didn't shut the government down in piecemeal, and so we shouldn't restart it in piecemeal. We should start it in whole. We should start all of the government for all Americans. And so now to the Affordable Care Act. When the Affordable Care Act passed, I have a gavel in my office. I was one of 4 members who gavelled in and out the Affordable Care Act, and so I got this really special gavel because I think, 40, 50 years from now, this is going to be a really special gavel. I won't be around to see what happens with it, but I was very proud to support the Affordable Care Act because I think it really is going to make a huge difference for Americans. And I know that it's going to, we've had fits and starts getting the Maryland exchange and our exchange. We saw the Washington Post, it was the bad news story the other day, yesterday in the paper. But I do think that these things are going to be worked out. How many of you have ever worked on software? Any software developers in the room? Yeah. And so, when you develop, I used to do little software development. And I'm of an age, I have to take my jacket off. But when you do software development, and you do testing, you think it's going to work. And I mean, that's the idea. You sit down, you write the code, you think it's going to work. And then it turns out when you get it operational, it doesn't quite work that way. And so what do? You go back and you make a fix, and then you work things out. And that's exactly what's happening right now with the software for the Affordable Care Act implementation. It's what's happening with the Maryland Exchange. But I'm actually excited about the prospects over this next 6 months, taking the time to get people who are uninsured or underinsured into the marketplace, signed in with their own accounts, choosing from 9 or 10 different plans Maryland has to choose from, and making a selection that makes the most sense for them and for their families. In Maryland, if you're a single person and you're relatively healthy, you will be able to get a health care plan for under $100 a month. And the difference that makes, let me tell you, is so Prince George's Community Hospital, I think they had something somewhere. Anybody here from the hospital? No. Anyway, they had about $35 million in uncompensated care routinely every year. $35 million in uncompensated care. If those people were not using the emergency room for their primary care and had insurance, that's a Prince George's hospital that is more than solvent, because that $35 million in uncompensated care is largely taken care of. That is the difference that it makes for our county. I was over at the Baden Community Clinic, and they also have a whole number of their patients that they see who are uncompensated. They said that once they get these people into the system and registered, and that they're, because many of them are working, they just can't afford the explosive cost of health care. But once they get in and registered, and then some of them qualify for Medicaid and the Medicaid expansion, that they will have enough money to build an addition and add an addition to the clinic to better serve the community. And so I do believe that this is really a strong positive for Prince George's County, for the state, and for the nation. The way the system works is that there are going to be, right now the federal government has agreed that for about the next 10 years it's going to pick up the additional cost of Medicaid, which would be about covering people at 400% of the poverty level. Then there are a whole set of people who go to work every day. They just don't make a ton of money, and they will, depending on their income, qualify for a tax credit. And the way that the software system works is it's not one of those things where you have to wait until you file your taxes to get your credit. The credit is automatically computed into calculating your premium, and so that happens right away. That actually makes it more possible for people who don't have insurance to get insured. Because sometimes I get a little annoyed with tax credits, because for working people, the prospect that you're going to get something a year from now doesn't help with your cash flow today. And so this credit actually works really, really different from that. And so it depends on your income, the number of family members, your health, and other factors. The other thing that I like is, how many of you have a pre-existing condition? Come on, raise your hand. I see some of you are about my age. I can tell you, I got several pre-existing conditions, and they may not all be evident, but I have them. And right now, if I wanted to switch health care plans under this old system or whatever, I would be, run the risk that I might not be able to be insured because of that pre-existing condition. And so we've eliminated those kinds of exclusions in health care. And this is a good thing, because then it means that people have a lot more flexibility. So if you wanted to change jobs, for example, you don't have to worry about whether or not you're going to be able to get your health care coverage and move it, because you've made that selection. It goes with you wherever it is that you go. In the state of Maryland, obviously in the Maryland Exchange. And, so that's good. Any of you have young people who are under age 26? Yeah, and so if you left it to their own devices, once they've come out of college or, whatever, would they buy health insurance? I have a 25-year-old, so I know what the answer to that really is. And no, they wouldn't, because they generally think of themselves as very healthy and they don't really need insurance. And so now, under the Affordable Care Act, you can keep your young person up to age 26 on your health care plan. I know when my son turned 22 and I got that faded letter from Blue Cross Blue Shield. Blue Cross Blue Shield, are you in the room? No offense. But I got this letter, and it's a scary letter that you get as a parent, and it says that effective his birthday at midnight, he would no longer have health insurance. And it freaked me out. And this was this was after the Affordable Care Act passed, but before the implementation of this age 26 provision. And so in the meantime, in between that time, I actually had to personally purchase a health care plan for him. Now he's a, David, you know my son, tall, strapping, healthy, young man. $500 a month.
Wow.
To get him a health care plan. $500 a month. And so in that in-between time, it ended up costing me almost $3,000 to cover him. And so I was really glad when, that January rolled around and I could add him back onto my health insurance plan. But now he's working, he pays his own health insurance. Good for him. But so those things are actually really important because they cost people money. And a lot of our young people, and this is the challenge that we have, is getting our young people enrolled. Because one, we need them because they're healthy, and so they don't draw down the cost, and they make up for people like me. And then two, we need them in there because if something happens to them, they're playing a basketball game, and they fall on their knee, and then they have to end up in the emergency room, and then they call mom. Jerry, they call mom, and they say, Mom, I'm in the emergency room, and by the way, I don't have any health insurance, and then you end up with the bill. And so we don't like that, parents. We don't like that. So we want them covered. We want them in the system. And so those are all, very positive. Now, many of you know, did you all get you got information about the Affordable Care Act? Good. Because at MarylandHealthConnection.gov, and I know I promise you it's going to get better every single day. And it's amazing the volume. Across the country, something like 7.5 million people tried to access the healthcare.gov, which then can take you to your state. And that is a lot of volume. It's like more than Southwest gets in a day. It's more than, a lot of our commercial online establishments get in any day. And I think it's because people are doing what we want them to do, which is they're shopping around. I went on because I was just curious about how to do it. I actually did it on my BlackBerry. So I punched out the little screen, to go to the state of Maryland and pull it down and stuff. And so I think that I know when I buy things online, I buy a lot of things online. And I go back to sites over and over and over again before I and I put them in my little box, in my cart, before I finally figure out that it's the purchase that I want to make. And I think a lot of people are doing that right now, and then they'll have this 6-month period during which they can actually really make a decision. And so I hope that all of you, and for those of you who are in your, run your own small business, the Small Business Exchange is going to be, available down the line next year, but that doesn't prevent you at all from having you and your employees go in and register to get yourself, to make sure that you're covered. And especially if you have fewer than 50 employees, you would want to do that anyway. I think what you're going to find is that it's less expensive. I know for me, although because of, more politics, but I was looking forward to going into the Maryland Exchange. And the reason I was looking forward to going into the Maryland Exchange is because our state, unlike a whole lot of states, one, we started early. We've been very aggressive about getting the system, sort of going. And we negotiated really, really great rates and plans with the health insurers. And so it turned out that I'm currently under the Federal Employee Health Benefits Plan. That is going to, for members of Congress and our staff, we are now going to be put into the DC Exchange. Not as excited about that, but whatever, I'll do it because they said I have to. But I really wanted to go into the Maryland Exchange because when I looked at the plans, I could have gotten actually a better plan in Maryland cheaper than the Federal Employee Health Benefits Plan. Yes, about half the cost, actually, yes. And so, but I'm now not allowed to go into the Maryland Exchange, but I'm going to encourage a lot of people to go into the Maryland Exchange for exactly that reason, because I know that if I was going to save money, then a lot of other people would save money as well. And I just think we're fortunate to live in this state versus some other places where they only negotiated with one company because they wanted to take it down. And so, they did that. And then there are 26 states that the federal government is actually operating the exchange because they have governors or state legislatures that made a decision that they just didn't want anything to do with Obamacare, David. And so they've decided not to do it at all. And I think the real challenge is going to be for the federal exchange one to work. But I think once you get into a place and you say to people who've never had health insurance before and haven't had the certainty of that, and they go to work, and most of these people go to work every day, and so they do have income. But once you say to them, you can have health insurance, and they get it, that it's just going to be like when Social Security and Medicare were implemented and everybody I went back and read the arguments on Social Security and Medicare, the arguments against those systems, and honest to goodness, almost word for word, all you'd have to do is substitute the Affordable Care Act. It was the same argument against those systems, and yet we can't imagine life without Social Security and Medicare. And so I think, over time, it's going to be largely the same with the Affordable Care Act. So I would just leave with you, that there are 800,000 Marylanders who don't have health insurance at all. That's like 14% of our population. It's a lot of people. And that doesn't even include the people who are underinsured or have been buying these crazy plans where they have like $5,000 deductibles, even though they know they don't have $5,000 in savings in case something happens. And so all of those folks too would get a chance to reevaluate their circumstance and then make a decision about health care. And then, lastly, I will say this, that over this next several weeks, there are going to be a lot of stories about implementation. I was talking with Dennis McDonough, he's the president's chief of staff, last week, and he said that they are going to start issuing a report monthly on the numbers of people who are signed up in all of the states and in every state. And so we will be able to, they will pull together a report monthly and they will be issuing that. I don't think it's particularly helpful to issue a day-to-day report about how many people have, gone on and signed up, because it's just not the way that people shop for health care. It's not the way that they make decisions. People want to go on and study and compare plans and kind of look at their family circumstances, and you really can't measure that day to day. So they will be issuing monthly reports. There is already started an aggressive rollout, both through social media and all kinds of ways, to try to reach that cohort of young people that I talked about, to get them signed up. A lot of our community centers, churches, leaders in the community are also reaching out to people, literally knocking on doors, saying, do you have health insurance and would you like to sign up? There are multiple ways that people can sign up. They can do it online, but for people who either don't have access or are not comfortable with that, there's an 800 number that folks can call. And, in some instances, there are meetings with navigators and others sitting in places, actually sitting down, going with people through the forms, paper forms, to get them filled out. And so however it is that people access information will be the way that they can sign up. Anyway, I think it's a really exciting time. I think for our small business community, or for people who are interested in being entrepreneurs, I think the whole idea that you're not just tied to whether you have health insurance kind of opens up an opportunity that might not have existed before, where you were making a decision to stay in your job because you were unclear about health insurance, and now you have some flexibility to think, well, maybe I could do something different. Maybe I could strike out on my own. And so I think there's going to be a whole avenue of entrepreneurs who, for the first time, really feel the freedom and flexibility to be able to do that. But we also have to have an economy that works, and we have to have people who are back at the jobs that they do have, they're just not getting paid for. And we have to have an economy that's working from the top to the bottom, and an education system that's working from the top to the bottom. And I think what we know here in Prince George's County is we also have a government and elected officials who are willing to work together, put aside, differences, and work together for the people who live here. We can see that happening with our big push to get the FBI and other federal facilities. We can see that happening in some of the economic development activity that's happening around our county. I have to tell you, I don't know about you, well, maybe I do, but I'm really proud to live in Prince George's County. I love it here. I talk about it all the time. And, I'd never pass up an opportunity if I'm on television to say, from Prince George's County, Maryland. Because I don't just want us to hear it. I want the nation to hear it, because we live in a really great county. We have a lot of challenges in front of us, but we have exactly the kind of people in the private sector and the public sector who are willing to make it work for the people who live in this county. And now we just got to go get the government to work. Small task. Anyway, thank you very much. If you have any questions, I'm happy to take a couple.
So, can you explain if so I'm married and I get insurance through my husband. So, with him having insurance through his employer, how could he go through the exchanges, or does he have to stay with his employer's plan?
What size employer?
Large.
It's a large employer. Should stay with his employer's plan, because you all are, with large employers, the benefit for large employers is you get to negotiate a big deal because you're a large employer. That ability to negotiate isn't going to change, and so you probably have, you have a good plan that's, worth the value. Where the exchanges are really helpful are people who are independent business people who don't have insurance on their own. People who are underinsured, people who are unemployed and not insured. There are there are millions of them, or 30 million of them around the country. And so that makes the most sense for what's happening with our larger employers, and we will see this, is that the rate of growth of healthcare is actually coming down. That does not mean, and people misunderstand this, it doesn't mean that your health insurance premium has come down. What it means is the rate of growth has come down. And so instead of growing above inflation, it's growing way below inflation. And that's actually a good thing overall for all of our healthcare costs. And so undoubtedly you're probably in a better position to stick to your employer provided plan. Yes, sir.
A couple questions. First of all, what sort of mindset here in regards to 30 hours being considered as full-time? And a second question is, what was the mindset in regards to not allowing constituents to be able to participate in exchanges outside of their state?
Yeah.
To make it even more competitive?
I don't know that it would necessarily have been more competitive. So, for example, I look at, like a state like New Hampshire. New Hampshire has one, that may change, but right now they have basically one healthcare provider. What we were able to do in Maryland, because both our governor and our General Assembly really enabled this to happen, is really aggressively negotiate, and those providers competed for business in Maryland. Now, I think that for us, we've gotten quite a good deal. And the fact is that in the federal exchange, because the federal government is operating basically in exchange for 26 states, those people are, in fact, all in the same exchange. I don't know that it's ideal. We enabled that kind of flexibility for states to operate because there was just such an animus against having a national healthcare operation. At the end of the day, once 26 governors have basically refused to implement it, we're kind of working our way to that anyway. And so we'll see. It may turn out that because these exchanges are up and running in those 26 states, and then in the other 10, 15 that where the state really is functioning and operating them, that some of those governors say, hey, this is not such a bad deal after all. I think that certainly has happened, I think, in Kentucky, where, it's one of those states where you might have predicted that they would go otherwise, but they didn't. And then with respect to the 30 hours, I mean, the notion is that you have to have some threshold that makes a determination that people are working full-time or effectively full-time. And, you know, I mean, was that going to be 30 hours, 35, 45? And so I think that, you know, and so the determination was made that, you know, that threshold is about 30 hours. I mean, that's effectively, you know, full-time. Anybody who works 30 hours a week and you spread it across, you know, 4 days or 5 days, it's, you know, it's full-time. And again, at the end of the day, I think that a lot of these kind of questions are going to resolve themselves because it's going to be overwhelmingly popular. Because people are going to want to take advantage of being able to at least pay even a minimal amount for the, you know, sort of peace of mind and security of having health care. There's a question here.
In the unfortunate event that there is a default, would you encourage and or support the president to the 14th Amendment deal?
Well, the president has said, and actually Secretary Liu on, I think, Meet the Press yesterday, basically said that the president has examined that from a constitutional perspective, and the president doesn't believe that he has the constitutional authority. Now, I might disagree with him. I'm no constitutional lawyer. I'm just like a two-bit lawyer. But he believes he doesn't have the authority and would not exercise it. And I will tell you this. The Congress of the United States has the constitutional responsibility to pay our bills. It's one of the constitutional responsibilities that's actually spelled out in the Constitution. And so we just need to do that, and we need to do it without jeopardizing not just the United States economy, but jeopardizing the world's economy.
First of all, good morning, and thank you for your great service. I wanted to mention one thing about the Affordable Care Act. In addition to being the obvious benefits you've outlaid for individuals who need health care, there's also some benefits for small businesses. Yeah. And so
tax credits.
So my company is working with the Centers for Disease Control, and we're doing a free training for employers because there's going to be tax credits associated with workplace wellness programs. And so we're teaching small businesses how to implement a workplace wellness program in order to be prepared for that. And so, you know, a lot of folks have different opinions about the Affordable Care Act, but I do think that, you know, despite where you stand, there are a lot of benefits for small businesses in addition to individual policyholders.
Well, let me just say this about the tax. You know, the tax credit currently is 35% tax credit if you provide health insurance for your employees. How many of you have taken advantage of that? That has been true since day one that the Affordable Care Act was passed. If you haven't taken advantage of it, go get your tax preparer to redo your tax returns and submit them so that you can get that credit. Pardon me? Yes, and then beginning in January 2014, that goes to 50%. And so if you provide health care for your employees now, you can get a 35% and then a 50% tax credit for doing that. And I'm not quite sure why a lot of tax preparers haven't really quite. I talked to so many small business owners and they had like no idea why they haven't. That hasn't either gotten into the software or something. I don't know.
Well, you know, I actually spoke to a CPA recently who talked about it, and she said she did the credit, and she said it really didn't amount to much for her clients.
Right. So amount to. I mean, if you. Well, I hear that, but amount to much versus zero. So I do hear that. But I mean, if they want to give it to me, that's fine too. Yes, ma'am.
I asked a question previously as to why you couldn't do an exchange in other states. My name is Angelique Best. I'm a board member, but I also have sold health and individual insurance for businesses and individuals. Insurance has always been governed on a state level. Yeah. So even previously, you could not live in Maryland and apply for a policy in Virginia. If you apply with a company, they would tell you, we're not approved in Maryland, or they have to give you a Maryland approved policy. And that's the same even if you're applying for a policy under your employer. If you work for an employer that has employees in DC, Maryland, and Virginia, that insurer has to offer policies that are approved in DC, Maryland, and Virginia. So that piece of the puzzle actually has not changed. It's just that a lot of people were not aware of that.
That is true, and I mean, and in fact, one of the things that we did in the Affordable Care Act is made sure that we actually gave additional authority to the state health insurance commissioners to review rates and things like that, which they didn't have before, and that has actually resulted in great savings to people. There are a number of people, for example, who have gotten. Anybody in this room gotten a check back from their insurance company? Well, I know people who've gotten checks back. I know I didn't get one. But the reason is because in the Affordable Care Act, there's a provision that requires health care insurers to spend 80% of their premium dollar on actual health care, and excludes things like marketing and other stuff that were previously sort of factored in there. And what the result has been is that there's some companies at the end of the year, the state health insurance commissioners have the ability to review whether they've done that, and they have to submit documentation that they've done that. And if not, those dollars have to be returned to the consumer. And the health insurance commissioners have the ability to make a determination about whether an insurance company is raising their rates excessively. This has actually helped to keep those premium numbers down over these last couple of years. That's a provision that I actually authored, and the result has been returning consumers across the country. The estimate from the Department of Health and Human Services is that that particular provision has saved consumers around the country about $1 billion.
Yes.
Thank you for some of the facts, because I'm just partially educated on the Affordable Care Act. But I had one of my main questions where I work for a large organization, and a lot of my colleagues are here today to learn more about that, Aerotech in Maryland. But what is the cost, and you can speak to this from a really high level, we don't need to get granular, but what is the cost associated with this program for these large businesses? You've mentioned tax credits and savings, but what is sort of the cost? Because someone has to,
Well, for a large corporation, I presume you're paying health care now for your employees?
Correct.
Right. And do you have an idea of how much you pay in the employer contribution?
We have an HSA, so yeah.
Okay. Well, I mean, most employers the large employers are contributing somewhere between 60 to 80% of the cost of the health care plan. And employers do that for a lot of reasons. This speaks to your question. They do it because you want to retain good employees, and one of the ways that you do that is provide health care and make sure that it's affordable for your employees. And so for you, if you're already providing health care for your employees, nothing really changes for you. The change that happens might be in the rate of escalation of healthcare costs, but nothing really changes for you. Nothing changes in terms of the way you might negotiate on behalf of your employees with your provider. Again, the changes that happen are really for smaller employers and for the uninsured. It's important for you to know, though, because you may have some. At some point or other, you may have some employees who, for whatever reason, they're leaving your company and they may be striking it out on their own or doing what they're doing, and so they might need to know what the changes are for the Affordable Care Act. But for our larger employers, you don't really see that much change. Okay, cool. I'm going back to try to get government started again.
The Agape Health Group, we were a sponsor of this event when we found out about this event, we stepped up to the plate because we wanted to help in getting the word out. And so we feel that this is our contribution back to the community.
We were very pleased to be able to partner with the Chamber in sponsoring this event for Congresswoman Donna Edwards to come and talk about some of the real facts about the Affordable Care Act. And also give us some of her perspective on the government shutdown and where she sees the problems moving forward.
In regards to the public regarding the act, there's some parts of it that I still have challenges with. But I think all in all, honestly, I think it's going to be something that's going to be a really beneficial act for the American public.
I was particularly impressed by the statistics she offered with regard to the number of people, one, out of work as a result of the shutdown, but specific to the Affordable Care Act, the number of people in the state of Maryland alone who are without health care insurance. And so that was staggering, and no matter which side of the aisle you fall, I think it helped to affirm the need for something like the Affordable Care Act to really try to engage more individuals in some type of health insurance program.
The federal marketplace compared to the state marketplace, how that's going to be implemented, and also basically how you have different choices. If you don't have a federal, Maryland has one of the premier state marketplaces, and she informed us that the rates are very competitive.
For those of us who are small business owners, it shed some light on a lot of the misconceptions and questions that I had as a business owner of how I can provide health care or at least information for my employees who don't qualify as full-time employees for health care.